Getting people off the streets is the first big step, but getting them help to recover is the other important piece.
That's right. Mental illness and drug abuse are huge problems among the homeless, and the answers don't always come easy.
Well, here to talk more about that and the governor's plan is Mike Arnold. He is president and CEO of the Midnight Mission in downtown LA. Welcome, Mike, and thank you so much for being with us this afternoon.
Thank you, and thanks for having me. I think it's an exciting time for all of us who are working in homeless services.
Absolutely. First, what is your take on the governor's plan to offer mental health services to the homeless, in some cases forcing them to get the help?
Well, there are different ways to sort of look at the particular initiative, but what we know for a fact is that there's been a huge gap between our ability to help people who desperately need help and their cognitive capacity to make choices that help them get the help that they need. So in the past, it was really conservatorship was the only course. And for folks who have dealt with people with an addiction disorder as well as a severe mental illness, such as schizophrenia, trying to go through the hoops to get a conservatorship is almost impossible. It takes a long time. It takes a lot of legal fees. So this is really intended to address severely mentally ill folks who have a disabling condition and desperately need help, but lack the cognitive capacity to make those decisions on their own. So for those of us who are down here and daily see the tragedy of people who, frankly, are just barely surviving, and certainly no way we would want our brothers or sisters to be, I think this fills a huge gap, and it addresses a huge need we've had in the homeless system for a really long time, and that is additional resources to address the severe mental health issues that we see. And part of what's built into this is the notion that, first of all, we've got to help people recover their cognitive capacity. And once they've recovered that, we know that they're going to want to pursue help and assistance. And we need to get them to that point. So this process is less intensive than a conservatorship, and it provides a vehicle for us to help people who we know really need help. So I think it's a great thing. It's a new paradigm. It addresses a big gap, and I think it's going to have huge impact on getting people who really need help and to get to safety off our streets.
Well, Mike, tell us this. What are you seeing on a daily basis? How bad is the mental health problem among the homeless in Los Angeles?
Well, we're right in the middle of Skid Row. We're sort of at the epicenter on 6th and San Pedro. So we are surrounded by people who are, frankly, pretty deep in addiction, as well as pretty severe mental health issues. And a day does not go by but what we don't see someone who we would desperately like to help, but who lack the cognitive capacity to ask for that help. And so where we are, this is really going to be critical for helping us help people and give them that pathway off the streets. No one wants to live on the streets. No one wants to live the lives that we've unfortunately made these people endure. And part of it has been resources, part of it has been a lack of focus, and part of it has been a lack of understanding of what folks who are severely mentally ill and homeless and have an addiction disorder need. So I think that this is a great step. It's a work in process. It's considered a framework at this point in time. But I really believe that it's going to provide a lot of relief, particularly for families who have loved ones who are suffering severe mental health issues and they've been forced to leave on the streets, to be able to get the help that they need to get back in a stable, safe environment.
All right. Mike Arnold with Midnight Mission, thank you so much once again for your insight and for being with us this afternoon.
Thanks, you guys. Appreciate it.